Hello, I'm Leah Binder. I'm President and CEO of the Leapfrog Group, and I'm pleased to be joined today by Dr. Michael Crovetti. He is owner and medical director of Coronado Surgery Center. Their ambulatory surgery center participates in the Leapfrog ASC Survey, and they are currently building a second location, which is being designed with Leapfrog standards in mind. So welcome, and thanks for joining me today.
Well, thanks so much for having me this morning.
So what drove you to decide to participate in the survey?
You know, I was familiar with Leapfrog in the hospitals and the Leapfrog survey. And, you know, I love when we grade things, right? And I think it's, if I could really summarize it, it's credibility through accountability, right? So Leapfrog is going to hold you accountable for your patient safety measures, your outcomes, your patient experience, and I love that. We work very hard every day. In every board meeting, we talk about how we can be better. And now we're actually going to be held accountable, and there's going to be that stamp of Leapfrog on our successes and some of the things that we can certainly do better, because everybody can be better.
Well, I appreciate that bold approach. That is to the benefit of your patients to have that approach.
No doubt.
Always want to get better. That's great.
You know who wins in the end of all this is always the patient.
That's right, and that's what it's about for all of us. So congratulations on your new site. And can you tell us more about designing the site and how you looked at Leapfrog for that?
Yeah, you know, it's again, when you're building a new site among many ASCs here in the Las Vegas Valley, your desire is to really set yourself apart. So when you start looking at Leapfrog and go through this survey, which I will tell you is an extensive project, and we've been working very hard on it with our administrators, our nurses. We've assigned small committees to put together some of the safety measures. If you think about one of the things I noticed was the hand washing and the putting a sink within 20 feet of every bed in the facility, every patient that's in the facility. Now, who thinks of that, right? That we're going to have a sink 20 feet away. So when I was going through the plans, it was neat to see we have a sink 20 feet from every bed. We had one that was 23 feet, and that is now 20 feet. So when we come back to the survey, you know, I'm one of those guys that I like to be, you know, the best in everything, right? We're surgeons, we love to be the best. And so now we're gonna make sure that all of the Leapfrog standards are met as we design, and even our board meetings, our preliminary board meetings, you know, as many months out as we are opening, are already talking about patient safety measures, which is just fantastic.
Well, and we'll look forward to seeing the results too. I mean, now you'll start to actually have procedures at your new facility, and your patients again will benefit. So
Always.
Very exciting. So how has Leapfrog helped you with your team? You just mentioned committee meetings, and I assume you have a very high functioning, high performing team of other clinicians and other professional staff. How has Leapfrog helped? Has Leapfrog motivated or helped with recruitment or retention of really great people?
You know, it really amazes me how our staff over all these years, number one, we have very little turnover in our staff, and certainly our surgeons, and my practice is a wonderful group of people. And, you know, this really told them, made them look at hand washing and surveillances in hand washing, right? So initially we were reporting it every quarter. Now we're reporting it every month, and we're meeting that minimum of 100 surveillances. And when you start looking at things and writing them down and start looking at infection protocols and drug administration protocols, et cetera, and all of these safety measures, people start to pay more attention than the attention they were already paying. And everybody wants to be part of something great. That's just human nature. So putting that Leapfrog stamp on and knowing that we are now watching and everybody's participating. It's not just me and the administrator watching them in the facility. Now they're watching themselves and each other. So everybody is participating. So it's created this work together environment for patient safety in the end, which is, again, right? We keep saying it. Our end goal is that patient. So it's been amazing.
What about transparency? That's a core part of Leapfrog's mission is transparency. We started out with hospitals, but now we're moving with ambulatory surgery centers toward a higher level of transparency about their safety. How have you found it to adapt to perhaps new expectations around transparency?
What a great question. We started joint replacement surgery in an ASC in 2010 when nobody thought you would ever do a hip or knee replacement in a surgery center. As a result of making such a bold move out of the hospital, we had a big target on our backs, right? So everybody was watching to see what kind of mistakes we were going to make, what kind of complications we were going to have, because we were in a hospital. We're 3,500 patients later, and every 500 patients I've reported to the payors through a white paper are results. And regardless of what the results were, that was my transparency to these payors. And I think it has led to a partnership as opposed to an adversarial relationship, a tremendous partnership with the payors. They really have wrapped their arms around what we're doing and really use us as a gold standard here in town, which is, and frankly, in the Southwest, I understand Aetna uses us as a gold standard for other ASCs who want to do joint replacement. So transparency and safety and outcomes. And secondly, is transparency in some of the new contracting that we're doing. So we're contracting directly with employers. We're doing these direct contracts. So now our pricing is transparent. We have 22 different orthopedic bundles that participate in our surgery center and in our bundle program. And a patient can shop that pricing, that bundle, through companies like Carum or Bridge Health. They can shop our pricing compared perhaps to pricing in another area or region. And of course, we're an ASC and not a hospital. So we're able to have some maybe more favorable pricing than a large institution. So our transparency has been both in pricing and certainly in patient outcomes.
Which is really a way to turbocharge your competitiveness. I mean, that is what employers want, is transparency.
It really is. And you really don't realize, or I didn't realize, I'm a physician, I didn't realize the healthcare spend that some of these large companies really endure. And in giving them, 8-10% of their healthcare spend, sometimes 22% in a discounted, higher quality delivery, really impacts their bottom line and really impacts the healthcare of their employees who love options where they can get something better at a better price, right? We all do. So I think that's been fantastic.
And make no mistake, employers want quality. I mean, if you ask an employer, and I know lots of them, I deal with them every day, the first thing they say is they want quality. That's why they're investing the first dollar they invest in healthcare. They want quality, they want excellence for their employees. That's first. And then they'd also like a decent price. So, and full transparency about all of it. So you're clearly leading the way on that.
We have 60 plus employees that work in our center and provide care for patients. When it comes time for me each year to look at their health care, you wouldn't believe that I actually sit down at a conference table with my staff and we go through the benefits. And we look at the HMO, PPO, point of service, the different plans that are available. And my wife and I choose what they want and what they see as best. And sometimes it costs a little more to get them a better plan. So imagine an employer that has 1,000, 10,000, 100,000 employees that they care about. So you're right. This is just a great option for them.
All right. So what advice do you have for your colleagues who are leaders of ASCs?
What advice do I have? Get involved. Number one, owners are not just owners who write checks and look at a very high level. Get involved in your center. You will be amazed at the things that you will see, the things that are going on every day that you have no idea about. hand them a Leapfrog survey, give them about a couple of months, right? Because you know how extensive you are and how deep you dig to see the quality and safety. And a couple of things you'll realize. One is you realize that your staff is already doing awesome things. They're already doing so many patient safety things and that you don't even know about. So that was really great. And secondly, you're making your staff part of something. Everybody wants to be part of something great, whether it be a team that you play on, whether it be your family, everybody wants to be part of something great. And the Leapfrog survey has brought my staff together to really with one goal, and that's to make patient safety better. What better goal could you have as a provider? So get involved in your center.
Well, Dr. Michael Crovetti, I want to thank you for joining me today and for the inspiring message that you have, not only for other colleagues of yours in the ASC community, but really for your own team. And I want to salute you and your team for excellence and for putting your patients first and for your incredible transparency. You've inspired us at Leapfrog, so thank you for joining us.
Well, thank you for holding us accountable for great quality care. And I really appreciate the opportunity to talk with you today.
Leapfrog is strongly supportive of Dr. Carvetti's leadership, placing sinks near patient beds to meet the Leapfrog hand hygiene standard. We currently recommend sinks be placed 20 feet near the bed. However, that is a preliminary standard. We encourage you to take a look at the ASC survey at leapfroggroup.org/ASC.